So we are going to talk about sexually transmitted disease, gonorrhea. And this is important because STDs are a very common issue in healthcare. Gonorrhea is one of them. And so this is caused by the Neisseria gonorrhoeae gram-negative Diplococcus bacterium. The Roman physician Claudius Galen actually named it gonorrhea because he thought it was from sperm, and the Greek word for flow of seed is gonorrhea. So it can affect both men and women. It causes various inflammatory issues, and it does have long-term consequences. And it spreads very easily because often it does go undiagnosed because a lot of women are asymptomatic. So it is important to educate ourselves on this, and hopefully we can stop or at least slow the spread. So the Maine has actually seen an influx in cases over the last few years. The U.S., it's actually the second most commonly reported notifiable disease for the CDC. It does occur only in humans, and it's most common in the adolescents and people who exhibit that high-risk sexual behavior, so that the unprotected sex, multiple sex partners, and frequent encounters. Interestingly enough, it's actually 4 times more common in the Black ethnicity versus the non-Black. So the most at risk is the adolescents and the at-risk sexual behavior. Obviously, the more often that you participate in that, the higher the risk. And men generally have the more notable symptoms, and so that's that painful urination and the purulent discharge. Women will more commonly be asymptomatic, and that can actually 50 to 80% of women have no symptoms at all, and that can go on for years. And again, that aids in the spread of this. But both can have symptoms, and it is usually that purulent drainage, painful burning sensation when urinating, and the women will, up on the vaginal speculum exam, you'll see discharge and inflammation of the cervix. They'll also experience cervical motion tenderness, and so that will often be described as like painful intercourse, or they won't be able to tolerate the speculum exam as well. It'll be a lot of discomfort. It can, if untreated, it can cause issues with the ectopic pregnancies and infertility and sterility, both in women and in men. It's rare in men, but it can. I'll talk a little bit more on why that is in the next one. But so it does cause a lot of inflammation, which can lead to pelvic inflammatory disease. It can cause pharyngitis, and that will be seen with the oral sex transmission. And to diagnose, it's usually just a swab, a vaginal swab, or a urine specimen that collected and will be sent to the lab for detection. So this is a very rugged, smart, potent bacteria. The Neisseria gonorrhoeae usually forms pairs of cells that have fimbriae, which are these little attachment appendages, so it really sticks on. It has the polysaccharide capsules and major cell wall antigen, which is composed of the lipid endotoxin and sugar molecules. For reference, cells that don't have these 3 characteristics are usually avirulent, which means they're not very potent, I guess would be the word. So this speaks volume to the potency of the Neisseria gonorrhoeae. It will invade by adhering to the epithelial cells of the mucosal membrane lining in the genital, urinary, and digestive tract. So that's the regular vaginal intercourse through, in the urethras. Oral would be, through the mouth, or anal. Mode of transmission, sexually, because it's an STD, and like with most bacteria in STDs, caused by bacteria, I guess is what I'm trying to say. They don't survive on dry, cool, inanimate objects. They prefer that warm, moist mucosal membrane. And Only a few hundred pairs of cells are actually needed to cause disease. So only a little bit of that transfer needs to happen before it becomes pathogenic in the susceptible host. Um, it can also protect itself from our immune system by secreting this protease enzyme, which breaks down the IgA. And another interesting thing is it's a hitchhiker. So this is back to what I mentioned earlier about the ectopic pregnancy and the infertility, sterility with male and female. So it will attach to sperm cells and hitchhike to the uterine tubes and beyond. So this is when you'll see that pelvic inflammatory, the chronic infections, which leads to scarring. And that scarring will then cause the infertility and sterility or the ectopic pregnancies. And then it also will, when our immune system is attacking in our white blood cells, it will, once it's phagocytized, can actually survive and multiply within the neutrophils, which I thought was pretty cool. It's pretty interesting, but also like kind of scary. And then it will hitchhike in those neutrophils and travel throughout the body. This is rare, but it is possible. But that's when we will see these gonococcal arthritis cases, because it will travel to joints. Babies, when they're delivered vaginally from an infected mother, they'll get it transmitted through their eyes, causing inflammation of the cornea and then ultimately blindness. So that's why part of prenatal care, they'll do the gonorrhea screening, and also after vaginal delivery, babies will have a azithromycin ointment applied to their eyes. So treatment for this is antibiotic therapy, which will stop the infection, but it won't undo any permanent damage caused by the bacteria. But this disease is becoming more difficult to treat because it progressively becomes drug resistant, and that's been increasing over the years. So in the 1980s, this is from the CDC, they found resistance to penicillin and tetracycline that had emerged, and so they no longer recommended that, which those were the two that were used to be treated. So fluoroquinolones were then the next recommendation, but then once again in the 1990s, they began having resistance and seeing cases, and it went widespread. So now, up until 2007, the CDC then recommended treatment for only one class remains effective, and that's the cephalosporin. So that's the cefixime, I can never say that right, and the ceftriaxone. So those two. And then in 2010, they took additional measures to try to stay ahead of it and combat that progressive resistance, and they recommend a dual treatment of azithromycin azithromycin and the injection of ceftriaxone, so those two together. And because they found they were starting to see a few cases pop up in the US that had resistance to that cefixime, so that's why they're like, recommend the azithromycin with the ceftriaxone. And so the important thing to remember with this treatment, once you complete it, it doesn't provide that long-term immunity. And so you can get it multiple times, and that is because of that variable surface antigen that I had talked about with the virulence factor. So once you have immunity against one strand, that doesn't mean that you have protection against a different strand, which is also why it's really challenging and difficult to develop an effective vaccine. So right now, the standard for prevention would be the safe sex practices, really. Abstinence, monogamy, consistent, proper condom use, and that is also with oral intercourse, consistent annual screening, and aggressive contact tracing with sexual partners of an infected person, and that's so that everybody can get treated. So although gonorrhea is not a preventable STD, or vaccine preventable STD, there are three, and that is HPV, Hep A, and Hep B. So HPV causes cervical cancer. So this actually is twofold, along with Hep B that causes liver cancer. So this vaccine is both of them are very safe and effective. The most common side effect for all three is the injection site reaction. That's that localized redness, inflammation, and tenderness at the injection site, which is on the upper arm. The effectiveness, I mean, HPV, within the 6 years of introduction of the first HPV vaccine, there was a 64% decrease in the prevalence among females for ages 14 to 19. Huge. I mean, that's over half. With the Hep A vaccine, 95% of the vaccinated people who were exposed were protected. And then with Hep B, the rate of new hepatitis B infections declined about 82% since 1991, which is when the CDC had incorporated it as a routine childhood vaccine. So it provides a greater than 90% protection. So they're all very effective, very beneficial, which certainly outweighs the risk of the very low risk side effects. I mean, other than causing discomfort, it doesn't really cause any permanent or long-term issues. So that's good. And then, of course, I have my references. So that's through the American Sexual Health Association, Lippincott Manual of Nursing Practice, Center for Disease Control, our textbook, Understanding Pathophysiology, and the World Health Organization.